2, 3. Hello everyone, good morning. We are here to present. Let me introduce my group. My name Silviyana, Dina Rosmala Silviani, and Berlina Trisni F U, and then Fatwa Khamal Yulianto. First speaker, please.
Case 1, years old woman suffer from severe smoking induced COPD with association hypoxia and hypercapnia. During a routine COVID visit, she stated that solved the needers. She would refuse intubation and ventilation under any circumstance. Here, physician fully explained the fact the patient in her circumstance often benefit from short-term intubation. The patient was switched into bed before and she was terrified by the discomfort, loss of control, and loss of dignity. Her physician stated that he will do all that he can to keep her comfortable and to make sure that the intubation period is as brief as possible. In spite of his assurances, the patient stated that she absolutely refuses intubation. Next. Ethical decision-making framework. Autonomy versus beneficent. Ethical problem statement. Shall the nurse continue to perform intubation and ventilation given the short-term benefit after the procedure without paying attention to the fear of discomfort, loss of control, and loss of self-esteem from the patient? Freedom versus control. Ethical issue, problem statement. Does the nurse have to follow the patient right not to perform intubation and ventilation under any circumstances because the patient refuses to be given it, regardless of the guarantee of benefit of the product of account of the patient right to refuse. Next. Data gathering. Relevant fact. The fact the patient is their current state often benefit from short-term intubation. Previously, the patient was intubation twice and she was intubation fearing discomfort, losing control and losing her self-esteem.
The first stakeholders. The patient refused to be given incubation and ventilation under any isometer because the patient was previously incubation twitch and he was intubation for first difference, loss of control and loss of self-esteem. Next. Next, consider nurse or doctor. The doctor explaining complex the path the patient in their counter that often benefit from short-term incubation. The doctor declares that the world to all her called to get her completable and to ensure that the incubation period is as short as as possible. Next. Option. The option one, doctor will not intubation the patient. Uh, Two, advantage, patient will feel comfortable, do not lose control and self-esteem because incubation is not performed. And then this disadvantage, this patient will feel comfortable, do not lose control and self-esteem because incubation is not performed.
Option 2, the doctor will still pressure the patient to perform intubation by explaining the procedure, benefits, and disadvantages of not doing intubation and telling the patient that the procedure will be carried out as comfortably as possible. Advantage: the patient gets short-term benefits from the disease. Disadvantage: the patient will still refuse the action of the doctor. Next. Option 3, doctor will look for other way to reduce COPD disease in patients other than intubation. Advantage: patient will feel comfortable, do not lose control and self-esteem because intubation is not performed. Disadvantage: patients are not satisfied with the results of other treatment. Next.
The decision and justification. The decision the doctor shall cause option to justification. The doctor must consider the patient, but doctor also shall not ignore the procedure that have been carried out as much as possible. The doctor shall be able to pursue the patient to intubation to reduce the discomfort of COPD, and the doctor must also explain the access intubation, the disadvantages of not doing the procedure, and the procedure so that patient feel comfortable when the intubation procedure is performed. Next.
Okay, thanks for attention. I think enough. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you.